Welcome to the deep dive. Today we're taking a fascinating journey into hyperbaric medicine in Latin America.
Yeah, it's quite a story.
You've likely heard of hyperbaric oxygen therapy, HBO maybe. It involves breathing pure oxygen in a pressurized environment, basically boosting oxygen in your blood to speed up healing.
It's a powerful concept, definitely. And it has this surprisingly rich history in Latin
Like it.
America. Its path has been pretty unique.
Exactly. So our goal today is to really get a handle on the current state of affairs based on some really interesting material we've looked at.
Right.
If you're someone who likes to get the essentials quickly, thoroughly, but without getting bogged down in, say, super technical stuff, this is for you.
Mm-hmm.
We're about to uncover a story with, well, unexpected historical roots, rapid growth, and also some really critical challenges. We need to unpack those.
Definitely some challenges. Okay, let's dive in.
Okay, let's get into it. Where do we start? History.
Let's start with a history lesson, yeah, that actually surprised you. The use of hyperbaric chambers in Latin America goes way back, early 1900s. Panama Canal construction.
The Panama Canal. Really? I never would have put those two together. What were they using it for back then?
Well, it was a very practical solution for a serious problem. Decompression sickness, the bends.
Ah, right, the bends. Okay.
Yeah,
Huh.
workers in the tunnels, the caissons, they were under high pressure. So these chambers were basically used to treat that condition. It could be debilitating.
So a really practical, almost industrial start.
Okay.
When did the more clinical side of HBO start popping up in Latin America?
The first documented clinical use we found was 1936. A researcher in Brazil, Osorio de Almeida. He published work on using HBO for lepromatous
Wow, leprosy. That's quite early and unexpected. It shows they were thinking creatively even then.
It does. And, the development wasn't the same everywhere. National navies were key in many countries. They saw the value for diving injuries, naturally.
Makes sense for navies.
But Cuba's interesting. They had this parallel development, clinical and undersea medicine, sort of right from the start.
Ah, okay. So while navies pushed it in some places, Cuba had this kind of dual focus from early on. That's a key distinction.
Hmm.
What about civilian hospitals? When did chambers start showing up there?
The 1960s, 1970s, that was really the turning point for the civilian clinical units. They started popping up, grew gradually, became more sophisticated, and eventually they became the main hubs for hyperbaric medicine in the region.
All right, so we've tracked it from industrial naval use to this growing clinical presence. So what's the picture like today?
Okay, this is where it gets really dynamic, but also complicated. You've got 39 countries in Latin America, incredibly diverse, right? Cultures, languages, regulations all over the place.
Yeah.
I mean, just think, Mexico alone, our source mentions over 50 languages or dialects. That kind of diversity, it really shapes how a specialized field like this develops and gets regulated.
Absolutely. You can't just apply one model there. But despite that diversity, the sources we looked at point to strong growth overall. Is that right?
Precisely. Yeah, despite all the variations, Latin America is currently the fastest growing region in the world for both diving and hyperbaric medicine.
Yeah.
There's a definite uptick in interest and activity.
That's encouraging. More recognition of the benefits, perhaps. What about the actual chambers? What types are mostly used there?
Interestingly, it's mostly multiplace chambers,
Yeah.
the bigger ones, right? They can hold several patients, even medical staff inside.
Right. Good for sicker patients, I imagine.
Exactly. The monoplace chambers, single person,
Mm.
often more automated. Their adoption has been slower. Seems like a couple of reasons for that.
Okay.
One, a lot of the established pros have naval backgrounds, so
Yeah.
they're just more familiar with multiplace systems. And two, the cost of oxygen is quite high in much of South America.
Ah.
And some monoplace designs need a lot of continuous oxygen flow, which makes them less economically viable.
That makes total sense. Existing expertise, cost.
Mm.
Yeah, those are big drivers for tech choices. Okay, let's shift gears a bit. Let's talk about something our sources flagged as pretty challenging. Regulation. Standardization.
Yes, this is definitely a critical area. You've got this surge in activity, right? But the big challenge is there are no unified regulatory standards across the whole region. None.
So no single body saying, these are the rules for everyone.
Exactly. Where rules do exist, they often sort of mirror U.S. guidelines for accepted uses. So there's a general idea of what conditions HBO is good for, based on evidence.
Okay, so the uses might have some consistency.
Right. But when you look at the actual safety, the operational standards for the equipment itself, the picture gets much, much fuzzier.
Tell me more about regulating the chambers themselves, the pressure vessels.
Yeah, this is a real point of concern. Some countries have rules for general pressure vessels, industrial tanks and stuff, but there's a serious lack of specific rules for pressure vessels for human occupancy, PVHO. And those standards are crucial. They address the unique safety stuff when people are inside under pressure. Without them, you've got potential risks, serious risks.
It sounds like a major gap. What about the different types of chambers, the multiplace versus monoplace?
Well, even within the limited regulations that exist, there's almost nothing specifically for monoplace chambers.
Really?
Yeah. And since they're being used more,
Mm-hmm.
that lack of specific safety standards is a potential weak spot.
So even if a country has some rules for pressure vessels, they might not fit chambers with people inside, and monoplace could be completely off the radar.
Precisely. Now, one potential fix mentioned is adopting the ASME PVHO standards.
Yeah.
American Society of Mechanical Engineers.
Right.
There are ASME-certified engineers in Latin America, so technically they could implement them.
But there's always a but, isn't there?
Yes, cost. Sticking to ASME PVHO standards, it can add 30, maybe 40% to the cost compared to local certifications, if those even exist.
Wow, 30–40%. That's a huge barrier, especially for smaller clinics, maybe.
Exactly. So, yeah, economics can unfortunately block the adoption of stricter safety measures.
Okay, so vessel safety is patchy. What about other critical things, like handling the oxygen itself? Fire safety.
Gas handling seems generally better. The source suggests gas cylinders, liquid oxygen systems. They usually follow international standards, like the U.S. CGA ones.
Yeah, that's something.
But fire suppression, specifically for hyperbaric chambers, mostly absent, even if the clinic or hospital has general fire rules.
Oh, that's alarming, given the high oxygen environment.
It's a major safety concern, absolutely. The fire risk inside is much higher. Lack of specific rules there. It's asking for trouble.
Yeah, absolutely critical. Fire safety in there is non-negotiable. So this overall lack of consistent rules, it seems to be causing some real problems, right?
Regrettably, yes.
Yeah.
Our source points to a really worrying trend lately. The spread of non-medical freestanding clinics using chambers that are uncertified, often cheap.
Uncertified. That sounds incredibly dangerous for patients. What are these places even treating?
It's alarming. They're pushing HBO for this huge list of conditions, over 150, the source said, often with zero ethical oversight, no real medical evidence.
Over 150 conditions.
Yeah. And these places can pop up anywhere. Beauty salons, even people's backyards.
Backyard hyperbaric chambers.
Yeah.
That's genuinely shocking. What about the equipment itself? Is it safe?
Often, no. These locally made chambers frequently don't meet any recognized pressure vessel codes. And it's not just the structure. The way they deliver oxygen can be dangerously inadequate.
Oh, so?
Some just pump oxygen in from a tank when they pressurize, and that's it. No more gas exchange for the whole hour-long session or however long it is.
Wait, just one initial charge of oxygen?
Yeah, which means CO2 builds up, other waste gases. It's incredibly unsafe, totally against established protocols.
How are these practices even spreading? How are they gaining traction?
Unfortunately, it seems a lack of good information and training leaves some doctors vulnerable. They get swayed by people selling these unproven, unsafe systems and protocols. So they end up buying these substandard chambers, using therapies with no real science behind them.
So it's a mix of bad regulation and, frankly, misinformation. And you mentioned something, ultra-low pressure acclimatization. What's that?
Yes, another really concerning thing some of these outfits promote. They start treatments at ridiculously low pressures, like equivalent to just 2 feet of water.
2 feet, that's barely anything.
Right, and they slowly increase it over days, claiming it's acclimatization. It has zero scientific basis in hyperbaric medicine. It just delays any possible benefit from proper HBO treatment.
This paints a really bleak picture in some areas, but the source also mentioned efforts towards standardization, past and present.
That's right, and it's an important counterpoint. Back in 1993, the Latin American chapter of the UHMS was formed, the Undersea and Hyperbaric Medical Society.
Okay, UHMS. What did that chapter try to do?
It was a big deal.
Yeah.
It acted as this central hub for information. They held meetings every 2 years, diving medicine, HBO, safety, and crucially, they tried hard to set minimum standards.
What kind of standards?
Things like safety, training for staff, how many staff you need, chamber construction, operation, and also guidelines for which conditions were accepted for treatment versus which were still experimental.
That sounds exactly like what was needed. What happened to it?
Sadly, it dissolved in the early 2000s, which was, a real setback for region-wide standardization.
A shame.
But The source does say various scientific ethical groups are still contributing, still working on developing the field responsibly.
So even without that central body, there are dedicated people pushing for best practices, and there's a recognized need now to sort of rekindle that broader collaboration.
Absolutely. There's a very clear, urgent need for a proper Latin American consensus meeting. To tackle these critical issues head on, the agenda would need to be pretty comprehensive.
What would be the top priorities for a meeting like that?
Okay, first, clear minimum standards. Design, building, inspecting, installing operating chambers. In hospitals and freestanding clinics, no exceptions.
Right, cover everything.
Second, minimum training standards for everyone involved, techs, nurses, therapists, doctors. Third, minimum staffing levels, what's needed for different kinds of units.
Makes sense.
And finally, standardized treatment protocols for the proven conditions and also for the investigational ones. Plus, clear ethical rules, research guidelines. You need that framework.
That is a thorough list. It's not just about having any standards, but the right standards covering safety, ethics, training, everything.
Precisely. The big goal here, standardize all hyperbaric activity across Latin America, stop the unsafe, unethical stuff, and also make it easier to do good multi-center research. That helps everyone.
Yeah, level the playing field based on quality and safety. The source mentioned a parallel with diving medicine standardization.
Yes, the Divers Alert Network, DN Latin America. It's a great example.
Yeah.
They split the region into 5 areas, and through volunteers, directors, doctors, they managed to develop standard safety rules, training, accident management for diving.
So it can be done.
It shows that region-wide standardization is achievable with collaboration and dedication.
That's really encouraging. So what's the path forward then? How do we get these standards implemented? And maybe more importantly, enforced?
Well, this force really stresses the immediate need to, first, take existing multiplace standards and make sure they properly cover PVHO pressure vessels for human occupancy. And second, create totally new standards just for monoplace chambers.
Okay, fill those gaps.
And a big Latin American master document outlining all these minimum requirements. That would be the foundation, the blueprint.
A go-to resource for everyone.
Exactly. Now, the good news is accredited hospitals, clinics, they generally do meet standards similar to the U.S. mostly. The exceptions are those specific PVHO and NFPA fire safety rules we mentioned.
Right.
The main challenge really lies with those unregulated freestanding chambers and the fact that even existing general pressure vessel rules aren't always enforced in some places.
So established places are mostly okay, but it's the unregulated sector that needs bringing into line.
That's the core issue. So the strategy looks like 2 phases. Phase 1, create that big minimum requirements document, make it accessible, point people to more info.
Get the information out there.
Phase 2, and this is the tougher part, actually work to get these requirements enforced locally, country by country, to eventually get region-wide standardization for safe, ethical practice, both in diving and hyperbaric medicine.
Sounds like a huge job, but wow, absolutely essential for patient safety, for the credibility of the field itself.
Couldn't agree more.
So, to wrap up our deep dive here, we've covered this long, pretty fascinating history of hyperbaric medicine in Latin America, from way back with the Panama Canal to today's clinical uses. We've seen the impressive growth, but also the diversity, the regulatory patchwork.
And those really worrying safety gaps and the rise of unsafe practices.
Definitely examine those. But importantly, we also looked at the efforts towards fixing it, towards standardization, learning from the past, looking ahead to try and ensure safety and ethics across the board.
And the need for that standardization is just so critical, especially when you think about the dangers of uncertified gear and unproven treatments.
Absolutely. This whole look at hyperbaric medicine in Latin America, it reveals this landscape of, yes, innovation and growth, but it's tangled up with some really serious challenges. It makes you think, doesn't it?
Okay.
About the wider picture, varying medical standards around the world.
Yeah.
What does it really take to get consistent safety, consistent ethical practices everywhere? And what role does international cooperation play in bridging those gaps, making sure new treatments actually help everyone safely and effectively?
That's a profound question. Definitely something to mull over.
Indeed. A lot to think about as we finish this deep dive.